Courtney. How are you doing today?
I'm fine. How are
Welcome
you?
to the
Good. I'm
Coleman
glad to hear. I'm doing
Evaluation of
well.
Living
My name's
Skills.
Angelina. I'm an occupational therapist, and I appreciate you coming in to tell us a little bit more about you.
Sure, yeah.
So what I have here are some tasks and some questions for you to fill out.
One of the first things that I observed about our client was that she was unable to complete the reading and writing form. So she actually only filled in her name, the date, and her age, which were all correct, but she did not fill out the time of day, which was 11 a.m., and she did not fill out the self-care activities.
Thank you.
Welcome.
I have some questions.
And here
to ask
I'm
you.
having her
Okay.
verbally
How
answer
often do
those
you
self-care
bathe or take a
activities that she
shower?
didn't fill out on the reading and writing form.
Once a day.
Okay. How often do you wash your face?
Once a day.
How often do you wash your hair?
Not as often. Maybe like once every 3 days.
Okay. How often do you comb or brush your hair?
She was independent in all of her self-care
Probably
activities.
every other day.
Okay. How often do you brush your teeth?
Twice a day.
Thank you so much for filling that out and answering those questions for me.
Yeah.
I am going to show you 4 pictures. There may be a dangerous situation in them, or there may not be anything dangerous at all.
Okay.
Look carefully at each of them. In each picture, you must decide if there is anything dangerous.
Okay.
Do you see anything dangerous in this picture?
No.
There is a safety concern in each of these photos, and the client
Do you
was
see
unable to
anything
identify
dangerous in this
any of
picture?
them.
No.
Okay. Do you see anything dangerous in this picture?
I don't think so.
Okay.
Why are you asking me these questions? This is stupid.
I understand you're a bit frustrated. Are you willing to keep proceeding with the test, or would you like to take a break?
I guess we can keep going.
Thank you. We can keep going. Do you see anything dangerous in this picture?
Maybe the cabinet.
The cabinet? What is dangerous about the cabinet?
She could hit her head.
Okay. That's your... Okay. What would you do for yourself if you got sick with a cold?
I would get help.
How would you get help?
Call 911.
Okay. What would you do if you burned yourself and the wound became infected?
Call 911.
What would you do if you suddenly started having severe chest pains and shortness of breath?
Call 911.
Here, some of the
house
client's
caught
responses
fire, what
are
telephone number would
appropriate,
you call
but
for
some are also not appropriate.
You are going to purchase this deck of cards from me. The deck of cards costs $3.38, including tax. This is the money you have to purchase the deck. Do you have enough money?
And here I can tell that the client's starting to get frustrated with this task.
This This is too good. I don't want to do this anymore. I need a break.
I directed the client to a restroom so she could collect herself,
Thank you so much
and
for
she
rejoining
requested to
me.
continue with the
If you need
test.
to take a break again, we can do that. Do you need any water or anything like that?
No.
Okay.
Fine.
Okay. I have a couple more questions to ask you.
Okay.
What is your source of
After
income?
the client swiped the money off the table, she
reception.
requested not to do any more
Do you have
tasks
any other
involving
sources
money
of income?
and was not required to do the
husband's.
payment of bills task.
Where do you work?
At urgent care.
Do you plan on returning to work there?
Yeah, I'd like to, but my doctor says it's probably gonna take like 6 months, so
When was the last time you took an Uber?
yesterday, and I really hate it. It's really annoying. I wish I could just drive myself again. I really miss driving my Camaro. It was really fun, so I just want to get back to that. Like, I'm so sick of this. It's really annoying.
Here is the telephone number for Regal Entertainment Group. Call the number and tell me the time the first movie will be shown today. If the telephone has a speaker option, please.
Nope.
Client took another break
So
to
much
help
for
herself
sticking with me
self-regulate,
through the assessment.
and
I
then
know some
she
parts were
returned to the
difficult at
test but
times.
refused to do
How do you feel
the
right now?
task involving
Glad to be
using the
done.
That's
telephone.
done.
Yeah.
Next session's not gonna be as structured. We're gonna have a less structured session.
All
the
of
next time you
these
come to
different
see me
clues point
with
me
a
to
lot
the
less
conclusion
paperwork
that the
and
client may
mess.
have a
But thank
mild
you for
cognitive
sticking through with me. I
impairment and may
appreciate
need
it.
help living on her own.